Well, you've heard them talk about it. Biden administration trying hard to reach the most vulnerable populations among us in hopes of meeting the president's ambitious July 4th vaccination goal. But Politico reports it this way. More than 5 months in, even a blueprint that's worked with other ethnic and racial groups isn't doing enough to win over Black Americans. To talk about it, we are so happy to welcome back to the broadcast the Reverend Liz Walker, veteran of local news, notably as City of Boston's first African-American weeknight news anchor. She is these days the senior pastor at Roxbury Presbyterian Church. She's been at the center of an effort to build trust in the vaccine in the city of Boston. Reverend, it's great to see you. Thank you so much for coming back on. You have warned about claiming victory too early. You have warned, in effect, about spiking the ball too early. Tell us why you said that based on what you're seeing in Boston.
Well, the problem, and I'm delighted to be with you again, Brian, even though the subject matter is less than what I'd want to talk about. The problem in Boston, the problem in the nation, in Black communities is the same as it was when we started. We still have people who have trust issues. We still have people who are hesitant. We still have great fears. We still have misinformation. So we're working on the same issues that we were working on when this pandemic got started. And we can't stop now. We can't just claim victory if there is no victory in our community. And that's what we're going to continue to work on here. We're trying to get the word out. We're trying to get deeper into the community. We're trying to get people to talk to neighbors and make sure that we're listening to people. And we're not going to give up because our numbers are dismal in communities of color right now.
Well, as a great man once said, let's choose to accentuate the positive. What have you found, even though the overall number is dismal, and we take your word for it, what have you found that works, even on a micro level?
Well, I think the thing that works is going into the community, to not expect people to necessarily come out to the sites that we've set up. But we're going to announce tomorrow that we have a mobile van in one of our communities, and we're going out into the community to go door to door, to put out flyers, to talk to people. Sometimes when there's hesitancy or fear, and I'm not assuming that everything is based on fear, but in some cases there is fear, you really do have to take your time and listening to people talk about some of the issues that are slowing them down, the reason they don't trust this. You have to have neighbor talk to neighbor, and that takes time. We knew at the beginning that you weren't going to change minds and change hearts overnight. These are trust issues that have been building for generations and generations. And so we are still doing the same work we've been doing. I think that things are slowly turning around. I think in Boston and the Boston area, our numbers are probably better than many, in the United States. So we're proud of the change that we've made, but we realize we have a long way to go. This was never going to be a sprint. And I want to say to all those people who are doing the hard work on the ground, talking to their neighbors and listening and being patient, we just have to keep it up. And that's what we're going to do. But I don't want anyone to forget, because what happens is if the majority population is vaccinated and we're all celebrating and we're all visiting and traveling, you forget the community that needs the vaccines more than anybody. And the life goes on. And then we hold, the burden of this disease even more so than we're holding now. That's my biggest fear, that this is going to continue to just kind of grow in our communities, and people are going to continue to get COVID and to get sick and to die. And I believe that's happening as we speak, though not in the bigger numbers that we heard about before. But in our community, the same kind of death, the same kind of illnesses. It's very scary.